I'm Sammy, and today I'm going to be demonstrating stick moxa or pole moxa on Michaela. She is coming in with some shoulder pain, mostly on the anterior medial aspect of her shoulder. There is stiffness, and this is an area where there isn't a lot of blood flow, and some people would call that frozen shoulder. When there's a lot of pain, it gets very stiff, and sometimes people can't even move their shoulder. So she doesn't technically have frozen shoulder. She just has pain. So we're going to use the moxa to warm the area as well as invigorate blood and build blood in the area. And what we're looking for is just a little bit of redness just on the area. So I'm going to hover the stick over the designated area, and then when the skin starts to turn pink, then I will move it to a new area. And I'm not looking for a heat that's intolerable. What I'm going to ask the patient to do, Michaela to do, is tell me when it gets about a 7 out of 10 hot, and then we'll move it to a new area. Do you have any questions, Michaela?
No.
Okay,
Sounds
so
good.
currently I'm just lighting the end of this moxa stick so that it is all the way hot. And it's important with this to hover it above the skin and be cautious as to not burn the patient. And one thing to take note of is if the patient had neuropathy of any sort or was diabetic, because there is decreased sensitivity as far as heat and cold goes. So we just got to be careful of that. But Michaela, she is not diabetic, nor has any sort of neuropathy. So yes, this looks hot enough. And we have our moxa extinguisher where we just brush the edges off to get any excess ash off. So we can utilize this stick to on certain acupuncture points, or we can do along channels. So this is the area in which the tightness is, so I'm just going to hover it above and take note of any skin changes that take place, or when she says it's too hot, then back it away. And there are different techniques that you can use with the pole moxa. You can do circular, you can do stationary, just holding it right over. You can also iron down the channel. You can do bird pecking, which is where you just go in, come out, go in, and come out. And each of these techniques delivers a different type of stimulation to the body. The technique I'm currently doing, just the slow circular technique, is more tonifying to the body. So it builds blood more. And now I see that the skin is starting to get a little bit red. So this is when you ask, are you feeling any heat?
Yes.
Okay, is it too much?
Not yet.
Okay,
Feels good.
okay.
It's got more.
Okay, so we back it away, and as you can see, the skin is starting to get a little bit red there. So that means we're bringing blood flow to the area. So now what I'm going to do is first remove any ashes so they don't fall on the patient. And then I'm going to iron down the channel. So this, we're kind of working along the lung, PC, and large intestine channels. Just a generalized area. Hot, okay. And one thing we didn't do, but is good to do, is do range of motion tests, especially for musculoskeletal issues, so that you can see the results of what you've done treatment wise. So the upper portion of the arm is getting a little bit red, so we don't have to spend as much time on that now. Do you have any questions, Michaela?
No, it feels
Okay.
really good.
Okay. And one thing to ask, especially with musculoskeletal problems, sometimes the pain can be originating from the shoulder, sometimes it can be from the neck, sometimes it can even be from the elbow or the wrist, even the hands. So you do want to ask if there's any pain along those other parts of the channel, you know, like the hip, the knee, the foot, etc. And just to see where the pain is really originating from. And then you kind of work along those other areas as well. So we're just gonna do a little bit more because it's almost all the way red. And the reason a lot of people will get frozen shoulders because in this generalized area on the anterior shoulder, where I had showed before, there is a hypovascular region, and so Moxa is great for that because it's allowing the blood to circulate better in that region. So yes, everything looks pretty even as far as color goes. So what we're gonna do is ask Michaela to move her arm, and then we'll see if the pain has decreased.
Oh yeah, feels looser now.
Nice.
Yeah, the tightness is gone.
Great. Awesome.
you.
Yeah, you're welcome. So that's just another type of Moxa that we have. We've got the pole Moxa, we have the direct Moxa. Whoops, we'll go this way. And then we also have Ibuki Moxa, which actually I can show you right now. Ibuki Moxa is just these stick-on things right here. You just take it off of the pad, light it, and then you place it on a specific acupuncture point. And it does primarily the same thing, it's just a different form. And then there's also cone Moxa, which is just where you have the herb itself, and then you crush it up, or you mash it together and form a cone, and then you put it directly on the skin. Yeah, and each of these types of Moxas are utilized for different reasons. Do you have anything to share?
No, thank you.
Okay, thank you so much. This is our Moxa video, and thanks for watching.
Thanks.